Hi everyone, and welcome to my podcast. My name is Enola Hastiin and I am a candidate for the Doctor of Behavioral Health degree with Cummings Institute for Behavioral Health Studies. For now, this podcast is used in conjunction with the coursework and coincides with classes requiring a podcast submission, but perhaps in the future it will become something more. Today we're diving into something that's reshaping healthcare, and that is integrated behavioral healthcare. Within this podcast I will be explaining just exactly what integrated behavioral healthcare is. It is important to note that this is the approach which I am learning with the Cummings Institute. This podcast will explain what integrated behavioral healthcare is, while also identifying the key skills which I am learning to implement, and why this should be important to you. Consideration 1. The current way of healthcare. Traditional care separates physical health and mental health. Patients are referred out separately for mental health care. Referring out leads to delays, confusion, and many people not receiving needed support. Consideration 2. What integrated behavioral healthcare does differently. Physical and mental health are treated together. Teams include doctors, nurses, mental health specialists, care managers, and the like. Mental health support is available right at the primary care office. Mental health care supports physical health care. Key points to emphasize. Physical and mental health care are not separate. Our brains and thoughts are as much as part of our overall well-being and daily functioning as is our heartbeat and blood flow. Consideration 3. Why it matters. Early identification of mental illness, improved physical health outcomes, easier, quicker access to mental health support. Reduced stigma surrounding mental health care. Now, let's look at two examples of integrated behavioral health care. Let's look at two ways in which integrated behavioral health care is more effective over the current separate models. Let us say that you are a patient coming to see your primary care physician in relation to controlling symptoms of diabetes. In the current healthcare model, your primary care provider is more likely to prescribe insulin and speak with you about how to properly use the provided prescription, maybe. Your PCP will also provide some general education about dietary change. This sounds great, right? Perhaps yes, that is until you go home and are faced with the psychological challenges of eating. Well, what can your PCP tell you about that? Little to nothing. In an approach to integrated behavioral health care, after prescribing you medications, you would then immediately be connected with a behavioral health consultant who may work with you to understand psychological interventions with eating, maybe. Like a basic lesson in how thinking impacts the desire to eat a cake over an apple, and then how by eating the cake reinforces the cycle of thinking and cake eating. What I've just described is a basic notion of a cognitive behavioral framework. That being, how our thoughts influence our behaviors and our behaviors influence our thoughts. The integrated model teaches basic thought-action awareness to support with the original complaint of managing diabetes symptoms. Now, in the second scenario, let's say that you come to your primary care provider for a basic annual visit. During this visit you and your doctor talk about how you've been feeling helpless, hopeless, and have been sleeping poorly. Your primary care suggests that you may be experiencing depression. Well, fortunately for you in the integrated behavioral healthcare model there is now a behavioral health consultant in the same office space as your PCP who can support you with a brief 15 to 30 minute psychological wellness consultation. Perhaps they support you with basic psychoeducation on mental health and sleep hygiene. Or perhaps you come back and see them 2 or 3 more times for a 30-minute consultations in where you learn solution-focused cognitive behavioral therapy, and if needed. Perhaps you are referred out to a psychotherapist for 60-minute talk therapy once weekly. In either scenario, the on-site behavioral health consultant working with your primary care provider was able to support you immediately as opposed to you having to connect with a psychotherapist on your own. Sit on a wait list to receive services, and, additionally, perhaps because you received help and support immediately, you do not need to see an outpatient specialist at all. In closing, integrated behavioral health care focuses on supporting the whole person regardless of a mental illness being present or not. True wellness comes from both emotional and physical health, and neither can truly exist without the other. Integrated healthcare is holistic healthcare for disease management, psychological support, and allows the marrying of each to support the betterment of yourself, that is, being a physically healthy and psychologically happy you. Final thoughts: integrated care treats people like whole human beings. It makes getting help easier, not harder. No one should fall through the cracks. It reduces the stigma of mental health care. To learn more about what was covered in this podcast, please visit www.psychiatry.org/patients-families/integrated-behavioral-healthcare.